So hello everybody, I'm Dr. Gioioso. I'm one of the OBGYNs here at County OB, and I know there's been lots of questions about COVID and pregnancy and the COVID vaccine and whatnot, so I'm here to address some of those for you. So basically, yes, unfortunately, COVID is more severe in pregnant patients. And this is happening not as much in Connecticut, of course, and that's just because we've done such a great job here at, making sure the majority of our population is vaccinated and staying safe. But in places like Nevada and Mississippi, and, of course, you hear about all, down south in Florida and whatnot, unfortunately, they are seeing a much higher amount of patients in the ICU who are pregnant. So one way that you can do that, besides like self-isolating and quarantining and being at home, is to get the vaccine. And now it's been such a great relief for us to be able to tell everybody, that yes, it is safe in pregnancy. Now they've, in the beginning, we didn't have the direct studies to say, yes, it's safe in pregnancy. But now, as millions and millions of people have gotten the vaccine, including hundreds of thousands of pregnant women, there have been no adverse effects because of it. And they have been doing more studies dedicated to, to see, like, in pregnant women, what happens. And so one of those things that they looked at recently was miscarriage rates. So there was no increase in miscarriage rates. There's no women being hospitalized after getting the vaccine. We do know that there are antibodies in the cord blood samples that they take. And so we were thinking that that actually shows that it is somewhat protective to your baby. We don't know to what degree, but anyway, so all of these are great things. All of our societies endorse it. American Congress of OBGYN, Society for Maternal Fetal Medicine, all of the big societies are heavily kind of saying, please get this vaccine. And I know that there is a lot of information out there. You're just trying to do the best that you can for your pregnancy and your baby. But please, as your OBGYN, you trust us with your care. I trusted it for myself. I'm almost 30 weeks pregnant. I would say that you should definitely get the vaccine. We do advise that you do wear a mask if you are going to be out and about with other people, just so that you can protect yourself and you can protect your loved ones who might not get the vaccine yet, like your children or elderly who will be more susceptible for having severe disease despite being vaccinated. So please wear a mask still, so that we can protect everybody. If you are a breastfeeding mom, please still get the vaccine when you're pregnant. It has no adverse effects onto your infant. We do see antibodies passing through the breast milk. And so we are, thinking that it is protective to your baby who can't get the vaccine yet, obviously. And so if you do happen to have COVID around the time that you're delivering, now, we would say, try to mask as much as possible, wash your hands, you're going to be around your baby, you're going to be breastfeeding, or whatever you want to do, obviously. But yeah, so if you do have COVID, you could pass it to your baby. And so there's still, again, low risk for getting extremely ill, but we do feel that, or the scientific population does feel that the children less than 1 are more susceptible to more severe disease. So you do have to be safe in that respect. So another question that you all might have is, what precautions are we taking at County OB to protect our patients and protect our staff? So we are following all the guidelines for, that were brought about by the Yale Medical Group and Yale New Haven Hospital. We are always wearing a mask at all times in our office, and when we are in the room with our patients, we are wearing eye protection as well, so that we protect ourselves and protect you. And then we also ask any patients or guests who are coming in to wear a mask as well. And so because we want to keep ourselves safe so we can keep you safe, And so, yeah, so hopefully that answers the majority of your questions. If you do happen to have any more, then please contact us anytime. You can call us, of course, or help@countyob.com. I'd be more than happy to answer any other questions. So thank you so much. We'll see you soon.